Hello, good evening, everyone. Can everyone hear and see me? Just put a thumbs up if you can. Amazing. Well, welcome to our webinar tonight. I'm thrilled, excited, overjoyed, honored that you've all come to log on tonight on this gloomy October evening. But I'm hoping that we will add a little bit of spark and light tonight, talking about a topic that I'm so passionate about, that I think is so important and so worth our attention. And that is how we can support you and your menstrual cycle. Now, people ask me, what made me decide to discuss this topic tonight? And a big reason why I decided to run this webinar is because I'm seeing so many patients in my office coming in looking for support around their menstrual cycle. It's one of the main concerns and conditions that I'm seeing in my practice. A lot of people are coming in with different concerns around that week leading up to their period and the first couple of days of menstruation, where they may be experiencing physical symptoms or some emotional symptoms that are really impacting their life and getting in the way of their happiness, their productivity, and their just overall well-being. And when we are having a period every month, right, and if we aren't feeling great a full week of the month, that could be like 25% of our whole life that we're not feeling our best. And so that's really important to address. And I do think that there's this idea out there that, if we have a period, if we are menstruating, it's just comes, part of the course that we're going to have some symptoms. And, while that is really common, many women experience symptoms of PMS or PMDD. It doesn't have to be that way. And so tonight we are going to be talking about what is PMS, which stands for premenstrual syndrome, and then what is PMDD, which is a little bit different. It stands for premenstrual dysmorphic disorder, and it's a more severe version of PMS. So what are these conditions? What could we do about them? How do we know if that's what's going on, and how can we help? So I'm thrilled today to be starting off. And if you guys have any questions at any point, I do have the chat box open, and I'll be looking at it throughout the presentation. So if you have a question about anything, just type it in. I'll do my best to, check it every couple of minutes and see if I can address any questions that come up. Okay. So I actually didn't introduce myself. I'm Daniela Jessen. I'm a naturopathic doctor. I work at Natural Choice Medical Clinic. That's me, as you can see. I have a passion for hormonal health. I would say 95% of my practice is focused on hormonal and reproductive health. Everything from helping people support their menstrual cycles, their periods, PMS and PMDD, which we're going to be speaking about tonight, regulating their menstrual cycles, all the way to helping support women on their fertility journeys, and then ultimately to perimenopause and menopause and beyond. So I have a big passion for this entire demographic in this discussion. A little bit more about me. I'm a mom. I have a little girl. I'm also a dog mom to a German Shepherd who is really 90 pounds, but just a love bug. And I am a nature enthusiast, which is a big part of why I moved to Guelph. Grew up in Toronto, and it's a great city, but me and my husband decided that Guelph was a little bit more aligned with what we love, and so thrilled to be part of this community. Okay. So what is PMS? What is premenstrual syndrome? So essentially, it can be a constellation of signs and symptoms that people may experience that week leading up to their menstrual cycle and, the first couple days of their period. So it can be a range of symptoms, right? And probably a lot of you on this call, I don't need to explain to you what that is. You've experienced them potentially yourself, or a loved one has experienced them, right? But physical symptoms can be things like bloating, breast tenderness, weight gain, feeling fatigued, maybe experiencing more acne or pimples during that time, difficulty concentrating, right? And then it can also come with some emotional changes. So, maybe difficulty with regulating our mood, more weepy, more irritable, feelings of food cravings. The list can go on and on. I missed a few things here. Constipation and diarrhea is another physical symptom that can come up. So there's a lot of vague symptoms, but when we're experiencing them, they can really impact our well-being, right? So let me move on to the next slide. So this here, it's a little bit of a physiology graph here. But what this picture is, it's a picture of our different hormonal fluctuations through the average menstrual cycle. Okay, so when I say the average menstrual cycle is between, about 28 and 35 days. And this is what our hormones do throughout this time. So it's a beautiful, sort of nice up and down. And what we can see, what I want to focus on here is, as you can see, sort of midway through the cycle. So if someone has a 30-day cycle, it would be around, give or take a couple of days, average would be around day 15, where we would ovulate. So an egg would get released. And if that egg is not fertilized, then that will stimulate the production of our hormone progesterone in the second half of the cycle, which we call the luteal phase. And then right before we menstruate, so right before we shed that uterine lining and we start to bleed, all of those hormones come crashing down. And that can be the time and sort of the trigger for experiencing a lot of these symptoms that we just spoke to on the slide before. So these fluctuations are normal, they're healthy, it's what we want to see. That's how, that's just how our cycle will go. But what can happen for women and anyone who's experiencing premenstrual syndrome, right, is we're having sensitivity to that drop in hormones right before we have our bleed. Okay. And so it's really important the reason I put this up here is it's really important to identify, when we're working up someone's concerns around their health, around their menstrual cycle, we want to sort of differentiate, is this PMS, right? So is it due to sort of these fluctuations in hormones, or is there something else going on? And that's a big part of our assessment, and we'll get to that later in our discussion of how we identify that. But essentially, it's not necessarily the actual fluctuation of hormones that we're worried about. Like I said, that's normal and natural, but some people have more sensitivity to the drop and that change, and it can exacerbate these symptoms. And so we want to support, our body and our well-being during this time of fluctuation. Okay. A lot of physiology. We'll move on to the next. So how do we know we have PMS? This is just one way to sort of identify what's going on. This is sort of a tracker that I might give a patient, right? It's a little bit of work, but it's usually worthwhile doing it because we can actually track our symptoms throughout the entire cycle, right? So you can see here, it's sort of hard to see. I apologize. We can always send this out later if anyone's interested in it. Not coming up so clear, but basically on the left side are sort of the list of symptoms we just spoke to a few slides ago, and we track when we're experiencing these symptoms. And the reason we do this is because a lot of women, if we ask them, oh, how did you feel that week before your period? It's sometimes hard to remember exactly what we noticed, and so this can be a really good way to track and become more aware of our body and what we're feeling. And if we do this for a couple of cycles and we see that, yes, these symptoms are lining up in that sort of time before we have a period, then likely that is PMS that we're experiencing. Another way to track, this is just a picture of an app that I use. I recommend people to use. It's really easy to use. It's called the Flow app. I'm not attached to any apps. I don't get any I don't get any what's the word I'm looking for? Pushback from recommending things, but I really like this app just because it's really easy. There's a few of them out there. Basically, when you get your period, you can just enter it in and it can help you track sort of your cycle and what's happening, because it can be hard to remember. Life is busy. There's lots going on, and sometimes it can be hard to remember when we actually had our period and where we're at it in our cycle. So this is just a really easy way to do it without having to think too much. Technology. Okay. So now we're speaking a little bit to something called PMDD. So PMDD stands for premenstrual dysmorphic disorder. And it's a different classification than PMS or premenstrual syndrome, right? And basically, the difference between PMS and PMDD is that PMDD is actually more of a mental health condition where we're seeing really marked debilitating symptoms for women during that premenstrual time. And we have to take both PMS and PMDD seriously and support people through this. But PMDD, it's really important to sort of differentiate the severity of what someone's experiencing. So, PMS might be breast tenderness, a little bit of irritability, feeling tired, right? But PMDD is just a more severe exacerbation of symptoms. So I'm going to read through this just so you can get an idea of the difference. So if you say, yeah, if someone were to say yes to these questions, then they could meet criteria for actually having PMDD, which we want to take even more seriously and really, really support that person with a diagnosis and also a proper treatment plan. Okay, so you can see here, I'll read this because it's a little bit small. The first one is, feeling like really having a depressed mood, feeling hopeless, self-deprecating thoughts. The next one is anxiety, feelings of being keyed up or on edge. The next one is marked affective lability. So that's suddenly feeling really happy and then really sad, feeling up and down, really tearful, or increased sensitivity to rejection. Then the next one is persistent unmarked anger or irritability or increased interpersonal conflicts. Okay, I know I'm reading these fast. The next one is decreased interest in usual activities. So that's if, the symptoms are really getting in the way of someone's functioning. So it's work, school, friends, hobbies. Subjective sense of difficulty concentrating would be the next one. And then the one after that is lethargy, easily fatigued, or marked lack of energy. The next one is marked change in appetite, overeating, specific food cravings. And then there's insomnia or hypersomnia, so difficulty falling asleep or feeling really energetic, or sleeping a lot, right? Hypersomnia would be oversleeping. So yeah, so either of those could meet criteria. The next one would be feeling really overwhelmed or really out of control, and then other physical symptoms of breast tenderness, swelling, headaches, joints, muscle pain. And we always want to say when we're going through this, to actually be classified as having PMDD or premenstrual dysmorphic disorder, we have to experience these symptoms only in that week leading up to our period. If we're experiencing these symptoms all month, then that's also important, but then we want to look to other causes, right? If someone might be, experiencing depression or other comorbidities that can be going on along the same time. But to have it classified as sort of connected with our menstrual cycle, we want to really only have these symptoms in that week leading up to that period. And that's important because the way we treat PMDD, there's some overlap, but it could be different from if someone was experiencing these symptoms all month, right? And so just important to know the difference. Okay, so lab testing. So everyone's always really interested in this topic of testing, and we do a lot of amazing testing in our clinic. We're really passionate about looking at the whole picture. So when someone comes into our office, we're not just treating a specific symptom, we're looking at the whole person. We're looking to rule out to make sure nothing else might be going on along the same time at the same time, and to try to really identify any obstacles that could be going on that is getting in the way of this person's well-being, right? So if someone comes in with, period pain, of course, we want to talk about their menstrual cycle, but we also want to look at all the other foundations of health. Now, with PMS or PMDD, it's actually quite interesting. There's not a specific test that we can do on lab work, and this is different than other conditions, that can diagnose PMS or PMDD. To diagnose PMS or PMDD, we go much more by clinical symptoms, sort of like what I talked about in the last couple of slides, to sort of meet criteria for getting a diagnosis for these two syndromes. But what is really important to do, and I sort of spoke to this on the slide before, is to rule out other things that can sort of mimic PMS, right? So to make sure if we're having a treatment plan for PMS, we're treating PMS and it's not something else, because lots of things can overlap. So if someone comes in and they're experiencing what they perceive as PMS, yes, likely that is what's going on, because everyone, is in tune and knows their body, and we always take that with importance. But we also want to make sure that there aren't any other things going on that can be sort of overlapping, and that, and making sure that we're treating the most appropriately. So other things that we want to rule out, we want to make sure that someone's not, maybe having a thyroid condition, which can manifest in, some of the vague symptoms that can also come up in PMS. We want to make sure there may not be other hormonal conditions or concerns like PCOS, which stands for polycystic ovarian syndrome. Is it possible someone might be in perimenopause? A lot of the symptoms of perimenopause can overlap with symptoms of PMS. And so we always really want to make sure that we're doing a workup to make sure that, yeah, no, this person's not in perimenopause. Because if they are, then we're going to approach that differently. Is it a medication side effect? So the birth control pill actually can be really helpful for some women for PMS. Sometimes when someone comes in with PMS and they go see their medical doctor, a birth control pill is prescribed, and it can be really helpful, and that's amazing if that is helpful. But sometimes, like any medication, like any supplement, some people, have side effects or don't feel well on things. And so, for example, the birth control pill can exacerbate symptoms that can mimic PMS for some women. And so we want to sort of differentiate, is this PMS or is this a side effect from a medication? Okay. Prolactin, so that's another hormone that can be elevated if we have potentially a growth, and that can lead to symptoms that can also sort of mimic sort of feelings of PMS. We want to rule that out. Of course, mental health concerns, as we can see, PMS and PMDD have a lot of overlap, and we can see a lot of those mood symptoms come up in those conditions. We want to differentiate. If someone's experiencing more of a major depression or mild to moderate depression, or if it's really more of a PMDD, more of a PMDD picture. And then, we always want to look at sort of our nutrient statuses too, right? Is someone anemic? Are they low in iron? That can definitely make someone feel tired and have a lot of the symptoms that, can manifest as PMS. Are they deficient in vitamin D? Are they low in B12? So we want to look at all of these things. And that's a big passion of mine, and actually everyone at our clinic, is we like to really sort of do this comprehensive assessment to make sure that we really come up with the best, most individualized plan for each person that comes in, and that we are treating the most appropriately. Okay. Oh, I think I just got a question. Is it common to experience PMS symptoms as early ovulation? Yeah, I mean, definitely. So ovulation, that's a really good question, Carolyn. Thank you for asking that. I actually should have mentioned before when I went through my physiology slide, we can only experience true PMS, and I'm not taking away from when people experience these symptoms in other contexts, but true PMS is really only experienced if someone is ovulating. So because ovulation sort of triggers that sort of fluctuation in hormone, if someone isn't ovulating or isn't having an ovulatory cycle, then usually those symptoms are due to another condition. And so, yes, ovulation and timing of ovulation can definitely impact, some symptoms and how we're feeling and some of those fluctuations around that. That's a really good question. I hope I answered that. And I just wanted to let everyone know, actually, this is a good point to say this, just with this question. I am offering free 15-minute complimentary meet and greets for anyone who attended this webinar tonight. If you have personal questions, if you don't want to ask on the forum, or you're feeling shy and you want to talk to me a little bit more directly, I'm offering free 15-minute consultations for you to check in with me and see if we may be a good fit to work together, if I might be the right person to support you on your health. So we actually have a little button here to book a discovery call if anyone wants to sort of speak to me on a one-on-one basis, and then we can decide if working together might be something that's beneficial for you. Okay, moving on. So what do we do? If we do all of this testing, we rule out all of these other conditions, we track someone's period, we track their cycle, and we say, okay, this individual is experiencing either PMS or PMDD, and we know that's what's going on. What can we do? How can we support a person? And this is, I think, why you are all here, to know how we can help you. Okay. And in this next number of slides, the next half of our presentation, I'm going to be talking about all the things we can do to support you. And I always just want to say, please take everything with a grain of salt. When we do meet one-on-one, to have, if you were to become my patient, right, everyone comes away with a little bit of a different individualized plan. So I'm speaking more broadly. I'm speaking about, all the different things that we could put into your plan. And some of these things definitely you can implement even just from this discussion. But other things are more specific. And so please, speak to a naturopathic doctor or come talk to me if you're curious about sort of more specific herbs or botanicals, because not everyone should take everything. We might choose a couple of these things for each person and pick the couple of treatments that might be best suited for you. Okay. So first thing that we want to talk about is nutrition. And, nutrition is a foundation of health. And when we think about PMS, I know I spoke to sort of those fluctuations that go on in a menstrual cycle and how those changes in hormones and that fluctuation of estrogen and progesterone, that drop in estrogen and progesterone can be what can trigger some people who might be more sensitive to those changes in their hormones. And so we don't, like I said, want to change the hormones. We want to change the person's response to those fluctuations, because those fluctuations are normal, but the response is what we want to work on. And so what I like to really think about is how can we sort of really create balance and reduce stress and create homeostasis in our body during this time, so that we can really keep our nervous system as supported and calm as possible, nourish our body, move our body, sleep well, meditate. All those things that we know are so important for foundations of health become really important for PMS, because those fluctuations can be sort of triggering on that nervous system. We want to try to really do everything we can to support that nervous system and support that person's body. So that brings us to nutrition. This is a pyramid of the Mediterranean diet. It's one of the best diets out there. Now, again, every diet has pros and cons, right? Again, it's a very individualized thing when we talk about nutrition, but the Mediterranean diet is a wonderful sort of guide, because it's very balanced. We're not cutting out any, macronutrients. Certainly, there may be a time and place for those types of diets, but for supporting hormonal health, we really want to think about balance. We don't want to be cutting out carbohydrates. We don't want to be cutting out, different macronutrients. It's all about basically giving your body a hug and nourishing. Okay. So the Mediterranean diet is exactly that. We see at the bottom, where you want to eat lots of fruits and vegetables, healthy oils, olive oil, lots of leafy greens, and then we see the next section up, legumes, whole grains, right? So we don't need to go carb free. We want to eat carbohydrates, but we want to choose healthy whole grain sources. Okay. And then we're looking at, lots of fish and seafood. And then, dairy and eggs are a little bit higher up on the list, right? And then, we're limiting a little bit more sort of those treats, which we can still have, of course, but they're just in moderation as more of treats. And this is just a really, really good picture to keep in our mind, and almost like picture giving our nervous system and our body a hug, and not adding to the stress by cutting out foods or over-nourishing either, right? So not under eating, not overeating, but just giving our body what it needs. Okay, talked enough about that. So this handout, this slide here, I have to say it's from a colleague of mine. I need to give credit where credit's due. You can see I had put a little bit of a citation at the bottom. But this is a 6 tips for diet. The first one is sort of what I just spoke to. It's work towards caloric adequacy without extremes. So we don't want excess. We don't want deficiency. We just want, adequate calories and whole foods, essentially. Okay. Now, number 2, some people don't like this one, and I understand it can be a hard habit to break. Alcohol, I know it can be, an enjoyable thing, and it can be a habit for many people, but alcohol can be really triggering for PMS and PMDD. And so, ideally eliminating alcohol make a huge difference for some people. It really can. I've seen it, how it can really, really reduce those symptoms. Now, I know that maybe isn't easy to do for everyone. And so another way to look at it is if we can really sort of eliminate or really limit alcohol in that luteal phase of the cycle. So again, the luteal phase is that second half of the cycle. So the 2 weeks leading up to our period. Um, if we can be more conscious or cognizant of alcohol in those 2 weeks, that can also be beneficial. So if you have a couple of drinks at the first half of your cycle, it's usually less harmful than doing it in the luteal phase when things are when we're closer to that menstrual cycle and we're seeing those symptoms come up. Um, healthy flaxseed is a really good thing to keep in your diet. It can act as a phytoestrogen, so it's helpful at modulating hormones, and soy as well. There used to be a lot of discussion around soy. Is it good? Is it bad? It was back and forth in the research. The research now is really showing that soy, especially, we really try to get more organic forms of soy where possible, is very beneficial for hormonal health. And so incorporating these foods into your diet are great ways to support PMS and PMDD. Working towards achieving a healthy body weight. So again, all about balance. Yeah, but if there is weight to lose and we can sort of reduce our weight, that can also improve symptoms of PMS and PMDD for some people. Now, reduction in sodium. So the reason this is on the slide is because a lot of the symptoms with PMS and PMDD are physical, like we spoke to at the beginning of the presentation. So things like feeling like we're gaining weight, bloating, sore breasts, water retention, right? And so sodium can contribute to that. And so we want to be mindful of our sodium intake, especially again in that luteal phase. And I know it's sometimes hard to, count milligrams, but a good guide is sort of to keep under 2,000 milligrams of sodium a day, and that can be helpful for some of those more physical symptoms for a lot of people. And then we want to have good sources of potassium for that same reason. Potassium is helpful for water retention and can make a difference in those physical symptoms. So there's lots of potassiums in fruits and vegetables. And so it is interesting that people who eat less fruits and vegetables or who are further away from sort of that Mediterranean diet, yeah, it can be something that can exacerbate PMS. We want to really have lots of fruits and vegetables in our diet and have those good sources of potassium for water retention. Okay. This is just a few pictures of, nice, relaxing self-care, which is always hard to find time to do, but it can be really helpful when we are experiencing PMS, just because of all of the reasons we talked about, really wanting to give that nervous system a hug. So just honoring our cycle. I'll go on a little bit of a tangent. That first half of our cycle, the follicular phase, which is day 1, starts when you start your period all the way to around day 15. This is in a 30-day cycle, average cycle. Some people feel like more energized, right? We can do those HIIT workouts. We feel more energized. Libido can be higher. And so we want to honor that time. Maybe we are more productive in that time. Maybe we can manage more HIIT workouts or going out more, doing more things, and that's okay. The luteal phase is really a time, and some people are more sensitive to this than others. Some people don't notice this, but for a lot of people, it's really that time where we want to sort of honor more of that rest and restoration. So taking more time for self-care. We will still want to move our body, but maybe, walking, cycling, swimming, weights, right? As opposed to more of that high intensity exercise can be more beneficial for that time in our cycle. And so sort of honing into those different phases of our cycle can be really helpful. And I find that once people start actually tracking, sort of with that big tracking sheet, we can actually start to notice. It's very hard when, we're busy in our life to pay attention. And I'm the same. I'm like, I don't remember if I was more energetic, last week versus this week. We're just getting through each day. But so I do find that when we actually start tracking, we can actually start to see the trend. And a lot of women do notice this. And so we just want to honor that time where, maybe we just do need a little bit more of that rest. Okay. And that can be really helpful for PMS. Okay. The fun stuff, naturopathic treatment. So, as naturopaths, I know some of you, I'm looking at the list of who is here. I know some of you have seen naturopathic doctors and have a little bit of an idea of what we do. But we have a really big tool bag, a really big toolbox. We offer lots of different integrative treatments. I personally do in my practice a lot of herbal medicine. I do a lot of nutraceuticals, lifestyle counseling, which we just spoke to. I do have my prescription authority, so sometimes we'll be, prescribing HRT or hormones, especially in perimenopause and menopause. So we do acupuncture. There's lots of cupping. I can just keep thinking of more and more things. So there's lots of tools. And when you come in to see a naturopath, you will come away with a really individualized plan that might take a couple of those tools, depending on what your goals are. And you'll come away with some suggestions. But here I just put a list of some of our biggest, strongest tools in terms of nutraceuticals and supplements that can be really helpful to support people through PMS and PMDD. Okay, so we'll start with vitamin D. Vitamin D, it sounds like a basic thing. Yeah, everyone should take vitamin D, but it actually is so incredible. It is a vitamin, of course, but it really can impact our hormones in a big way. So vitamin D is really important for mood. A lot of research, connecting low vitamin D status with more difficulty with low mood. It's very important for bone health. There's lots of benefits to it. And particularly if you're deficient in vitamin D, it can certainly exacerbate symptoms of PMS and PMDD. So the first thing I always recommend with vitamin D is actually testing our levels. I'll come back to the slide in a second. I put a picture here of a vitamin D blood test. So this is something I see commonly in my practice when we test vitamin D. A lot of people are actually sitting in the deficient range, even if they're already supplementing. So this patient that I have here, she was actually supplementing with vitamin D already. She was taking 1,000 IU of vitamin D, which is the recommended daily dose. But even still, she was still sitting in that deficient range. And so, why is it important to test? Because that it helps to guide us how high of a dose we can give, right? We don't want to give big doses of vitamin D if someone's not deficient, because we don't want to overdose someone on vitamin D either. But it is so important to test because this person here, she was taking 1,000 IU and she was still sitting in this deficient range. So in this case, we were able to offer her higher dose vitamin D. I do vitamin D injections in the clinic. So this person actually came in for vitamin D injections so that we can get her vitamin D up. So I highly encourage anyone who's experiencing PMS to have their vitamin D tested, because if we can correct it, and it is very easy to correct once we know your level, it can be a huge factor in supporting PMS. And I always say with PMS and PMDD, we want to think of a pie, right? And so all these little different things can be pieces of the pie. And when we meet with you, we want to sort of figure out every single little pie piece that can be contributing to, your whole circle of maybe reasons that we can identify that might be able to be improved and improve your symptoms. So vitamin D is certainly a piece of that pie. Okay. Oops. I just want to see here. Okay. To the slide before. Calcium also seems like a very, basic mineral. But calcium, there's a lot of research with calcium and taking calcium sort of in that week leading up to your menstrual cycle. And it can be very, very helpful for PMS symptoms. A lot of people are low in calcium, especially premenstrually. And calcium, it can be extremely helpful in managing PMS and PMDD. And again, please don't go and take all of these. This is way too long of a list. You might benefit from a couple of these once we figure out what's going on for you. Okay. Magnesium and ginger also really helpful. Ginger is really, really helpful. It acts as an antispasmodic. So for women who experience actual menstrual pain and cramps, ginger can be really helpful at sort of alleviating those menstrual cramps and menstrual migraines, just because it really can act as an antispasmodic, we call it. Magnesium too, probably a lot of people have tried to take magnesium in the past. It's very helpful for sort of relaxing muscle tension. It can also be helpful for some of those symptoms of water retention, and also can be helpful for period pain. Okay, fish oil, another great one. Fish oil is good for so many conditions. It's endless, but for PMS, it is certainly an important tool as well. Fish oil can be, when taken in the right dose, can be extremely supportive for mental health, for mood. It's a huge tool for mood and mental health, and it can also help with some of the physical symptoms of PMS. So fish oil is a funny one because there's so many different fish oils out there. I mean, you can go and do a PhD in learning about fish oil. There's so many different ones, and it's hard to know which one to take. And again, everyone's different, but when it comes to fish oil, you always want to look at your labels and make sure you're getting an adequate dose. A lot of fish oils have really low dose, and they can have a lot of fillers in them. And so if you're investing in a fish oil, you want to make sure it's a good one. The things you want to look for in fish oil are two fatty acids. One is called EPA, and one is called DHA. And EPA is very anti-inflammatory, and it can be really helpful for that reason. DHA is also a really important fatty acid, also can act as an anti-inflammatory, but it's also very, very important to support mood and cognitive health. So we want to make sure that those two ingredients you have good levels of those in your fish oil. And so I always encourage you to, ask for a recommendation or, look at the label to make sure that those are in high amounts. Otherwise, sometimes you might take a fish oil and think, oh, that didn't really help me. And it's possible that it didn't help if it just wasn't a high enough dose or a high enough quality one. So we want to be really picky with those. Okay, to our list. Vitex or chasteberry is an herbal medicine. It's a botanical. It has tons of research on helping with PMS and PMDD. It can be a game changer for the physical and emotional symptoms of PMS and PMDD. This is one I use a lot, and it's incredible how helpful it can be. I don't know what else to say about it. I love it. Again, always check in before taking everything because some of these things can interact with different medications and they're not for everyone. Phosphatidylserine, it's a mouthful. This is another nutraceutical. It's getting more attention. That can be extremely helpful for mood support around PMS and PMDD. I'll come back to the progesterone question mark. But saffron also is an herb that also is used a lot for mental health. So that's also another option. St. John's wort. A lot of you may have heard of St. John's wort. It's a really popular herb. It's also an herbal medicine. It has a lot of research on it that is actually comparing it to the effectiveness of SSRIs or antidepressants for mild to moderate depression. So it can be extremely helpful for people who are experiencing sort of more of that PMDD constellation of symptoms where their well-being is being really impacted. Again, St. John's wort can interact with a lot of medications, so please don't take it unless you speak to a professional to make sure it's the right one for you. But it's a very safe herb with a lot of benefit if it's used correctly. Okay, all heard of chamomile. You can have chamomile tea. You can take it in a pill form. You can take it in a tincture form. It's an herb as well that can be just super relaxing. There's a lot of other relaxing herbs that we use too. Things like passion flower, things like valerian, things like lemon balm. A lot of the time I'll actually make a tincture, so a personalized medicine for someone who comes in to see me, using different herbs to create an individualized medicine, so we can pick specific herbs that are helpful and create sort of a personalized medicine for you using these herbs. And I do love using them. They can be really helpful for sleep support. They can be really helpful for stress. And if we're feeling that a lot in that premenstrual phase, that can be a really good tool. GABA and L-theanine, these are just more of the same. I mean, they're different. These aren't herbs, these are nutraceuticals, but they work on our nervous system to sort of keep that nervous system calm in a very gentle way. We always say we have our autonomic nervous system. One side of it is sort of that fight or flight state of our nervous system where there's stress, right? And we're having adrenaline, right? And then we have that other side of our nervous system, which we call the parasympathetic nervous system, which is more helpful for resting and for digestion. And so we want to really hone in into that parasympathetic nervous system state if individuals are experiencing a lot of high stress and anxiety, especially in this time. And these two nutraceuticals can be really helpful at calming that nervous system and helping in that way. Okay. Yeah, so this is I just sort of broke this down a little bit further. Oh, I forgot to talk about one thing. I put progesterone here with a question mark. Progesterone used to be used a lot to help women manage their PMS and their PMDD. It's a interesting conversation. Um, a lot of the new research is sort of shying away from using it. Sometimes it can exasperate symptoms for some people, but it is a discussion that we would have based on sort of what's going on, and if we can if we identify that maybe you are having low progesterone in that second half of the cycle, it could still be a tool that we use for sure, and it can still be helpful, especially if women are also in perimenopause. So that's when we start to see the lines blur. If someone's experiencing perimenopause and then also noticing sort of symptoms that feel like PMS, progesterone is usually can be a little bit more of a helpful choice versus if it's just PMS, then it's still something we might try depending on what's going on, but we want to be a little bit more cautious about it. And I do prescriptions of different bioidentical hormones in our clinic. So it is an option to discuss if it's something that you were interested in. Okay. Okay. Oh, I know I'm done a little bit early. I was talking really fast. But I just wanted to reiterate that I am offering free discovery calls, just a reminder. So if, I know there was a lot of information in these slides. My message at the end of this is that, oops, sorry. My message at the end of this is that we are here for you. If you are experiencing symptoms of PMS or PMDD, please reach out. You don't need to suffer with this. Again, it's not just part of having a period or a menstrual cycle. There are things that we can do, and it's a passion of mine to really look holistically at all these options and come up with a plan that's most supportive for you and what you're dealing with. So yes, would love to connect, would love to chat with you if this is something that you're experiencing. And if you have any questions, I'd be happy to answer them. This is just the information of our clinic, our address, our phone number, if you need to connect with us. And this is a picture of my German Shepherd cross named Sherman. I just thought it was such a cute picture that I had to include him. So thank you so much for coming tonight. I so appreciate you taking the time to listen to this presentation. And I'm really grateful and looking forward to connecting with you if this is something you want more support with. All right. Thanks, Allie. I'm going to log off. Okay. Bye for now.